Hey everyone, I have posted all the materials for the online course. I wanted to just highlight a few things about this week's assignments. I have, for the vitamins and the minerals, very pretty much self-explanatory. I've posted a chart for your online learning activities that you can earn 5 points for, and it's going to help you organize the thoughts regarding those vitamins and minerals. I only need you to cover the ones that are listed in the chart. A couple of things I just want to mention in terms of important take-home points. Number one, with iron, frequently used for anemia, the oral form is easy to administer, obviously. Keep in mind that it does cause nausea. However, best given on an empty stomach with a glass of vitamin C, orange juice. It actually helps with the absorption of the drug. However, because there are a lot of GI upset symptoms associated with the drug, some patients tolerate it better if you give it with meals. The other thing to inform your clients is that the drug will cause a black tar stool, and it causes terrible constipation. We use it quite frequently, post-op, hip, knee, and keep in mind these clients are already immobile. They're probably taking a pain pill for their incisional pain, which increases the risk for constipation. So automatically, these people should be started on a stool softener to prevent the constipation from occurring. Some other things, going back to the nausea then, they should take it on an empty stomach. However, if they are having a lot of nausea, they can go ahead and take it with meals. Another important point to remember about the oral is that it does interact with several of the antibiotics, specifically penicillin, tetracyclines, and Cipro. So you want to avoid, they need to be spaced out because it'll interfere with their serum levels. There is an IV form of iron called dextran. It is given if the patient is severely anemic. Because of the high incidence of anaphylaxis, there should be a test dose that's given. The patient should be monitored very closely during administration of the drug, and emergency equipment in terms of anaphylaxis should be available. Monitor vital signs closely and watch for those symptoms. One other point about iron, liquid form is taken diluted and it with a straw because it does stain teeth. A few notes about vitamin K. We usually give it sub-Q. Administration IM or IV increases the incidence of allergic reactions. And I guess the most important take-home point with vitamin K is that it is the antidote for warfarin or Coumadin overdose. Potassium, a couple things to keep in mind about that is if you're giving the, not the pill form, but the powdered form, if you will, it needs to be mixed in 120 mils of water. Potassium should not be crushed. IV, we never give it push. We always dilute it, and it should be on a pump. Remember, fluid and electrolytes can be very tricky, so you could very easily move into hyperkalemia when you're giving potassium supplements. So we're going to watch for the potassium level, and in the event that they become hyperkalemic, then K-exolate is the drug of choice for that. I have a case study posted online for you to do. It will help you with application of the content, and it doesn't count for any points, but I think it's a nice little activity. You can take it as many times you want. I've put the answers in there for you. And then after you've done the readings and completed the activities, there's a PowerPoint on vitamins and minerals that has no audio. I've got another YouTube video up for the immunostimulant drugs. Complete those activities, and then you can go ahead and do the online learning assignment and submit that to Moodle by next Tuesday at 7:30 a.m. hang in there, guys. This is the home stretch. I know you're all tired. Me too. But we've only got 2 weeks left, and I'm asking you to give me everything you got during these next 2 weeks. Okay? Have a good week.